Some of you may be disengaged. The path of the righteous man is beset on all sides by the inequities of the selfish and the tyranny of evil men. Now blessed is he who, in the name of charity and goodwill, shepherds the weak through the valley of the darkness, for he is truly his brother's keeper, and the finder of lost children, and I will strike down upon thee with great vengeance and furious anger those who attempt to poison and destroy my brother. And you will know that I am the Lord when I lay my vengeance upon thee. I got one thing to say. King Kong ain't got shit on me. Are you still disengaged? No. Okay, fantastic. Right, so, hi, welcome. I'm so pleased that you could all make it. I'm Dr Ahmed Hankir. I'm an academic clinical fellow in psychiatry with Manchester University. And I'm going to be giving a talk today on the wounded healer. So the aim is to provide you with a brief overview of bipolar disorder, broach a little on stigma, describe the association between creativity and craziness, introduce you all to the health humanities, and explore how autobiographical narrative is gaining popularity among doctors who have mental health challenges. I'm going to provide you with a qualitative insight into the mind of a medic who has manic depressive illness, which is essentially a case report of the wounded healer. And I'm going to describe my experiences as a Lebanese man delivering a keynote lecture in the World Psychiatry Association International Cultural Psychiatry Conference in Tel Aviv. So I will be identifying the merits of autobiographical narrative. Does anyone know what that means? You know, when you just essentially write about yourself. So by definition, I will be referring to myself. I hope you don't mind. Very proud of some of my accomplishments, and I hope that's okay with you. Now, I stake no claim in being master of the phenomenon that has afflicted me. If any of you are under mental distress in any of its many forms, the best recourse is to consult a GP. Are you all registered here with the GP? Yeah? Good. Okay, so my talk will be making reference to some very, I guess, intense experiences in my life. Now this may or may not evoke strong feelings and emotions, which is not necessarily a bad thing. So the methodology, a non-systematic review of the literature was conducted. First-person narratives of doctors who have mental health challenges were collated and qualitatively analyzed, and the presenter is a Lebanese doctor specializing in academic psychiatry right here in the UK, and I'm going to be talking to you about my own personal experiences with oscillations in my mood, and I'm going to attempt to illustrate the psychosocial, religious, and occupational factors that influence disease detection, progression, treatment, and outcome. My man with the plan. Welcome, Asad. Welcome. Come in. This is Asad Siddiq, the consultant psychiatrist. He's here to make sure that everything's okay, facilitate the proceeding. Help yourself to some pizza. For those of you just arrived, you can collect the feedback forms afterwards. That'd be grand. Okay, so my narrative will not delve so much into the basic science of bipolar disorder. What I want to convey is the subjective experience of profound oscillations in mood and how this can have an effect on cognition, behavior, functioning, both occupational and social. Now, I have utilized the tools of verse and prose in an attempt to achieve those goals. This is going to be an ode to night smooth thinking. Try and trace the thread in my train of thoughts, if you will. The gauntlet has been thrown. Ours is a world of metaphor, intrigue, fantasy, and deceit. Does anyone know what night smooth thinking is? Night smooth thinking. So, do you have any chess players here? So you know you're playing a bit of chess, and all of a sudden your adversary claims your queen with his knight. You didn't see that move coming. You're like, WTF? You just claim my queen, because it's difficult to trace that movement, isn't it? It's not linear. So it's a kind of thought disorder, and Asad will know more about it than me, because obviously he's a consultant. So it's when you're doing a mental state examination, you're assessing the patient's thought form and thought content. Nice move thinking is an abnormal thought form. Okay? Maybe some of you still don't get the picture. Well then, allow me to demonstrate. I'm going to outstretch my hand, and I dare you to reach out and grasp it if you so will. Allow me to transport you to different time and place. But the caveat is, fasten your seatbelts, because bipolar disorder can be a bumpy ride. So, 7th century AD, we are in the Arabian Peninsula, in the bazaar. Traders have come from far and wide to barter frankincense, silk, and spice. But there's some commotion in the corner. The poet has taken to the pulpit. Bread and water do the poet have in Hakim's house, where verse and prose are nightly put to slaughter, and the bread I swear over there, it's thinner than the water. Open a space you love as a poetry to Richard Taylor. Willing and rich, patron of the arts, when Richard invites a poet in, their joy is kith and love is kin, where wines and cakes abound, the skills of verse are found. All revels and all songs begin, when Richard Taylor invites the poet in. Man, free thinker! Do you imagine you alone think in this world, where life is blazing forth in all things? You are free to avail yourself of the forces you command, but the universe has gone missing from your prescriptions. Once upon a midnight dreary, while I pondered weak and weary over many a quaint and curious volume of forgotten lore, while I nodded nearly napping, suddenly there came a tapping as of someone gently rapping at my chamber door. 'Tis some visitor, I muttered, tapping at my chamber door, only this and nothing more. So you think the darkness is your ally? You merely adopted the dark. I was born in it, molded by it. I didn't see the light until I was already a man by then. It was nothing but blinding to me. Your shadows betray you because they belong to me. My father's people say that at the birth of the sun and of his brother the moon, the mother died. So the sun gave to the earth her body, from which was to spring all life, and he drew forth from her breast the stars, and the stars he flew them into the night sky to remind them of her soul. Let me tell you something, Miriam. A man's heart is a wretched, wretched thing. It isn't like a mother's womb. It won't bleed. It won't stretch to make room for you. Remember that. I've seen things you people wouldn't believe. Attack ships on fire off the shoulder of Orion. I watched sea beams glitter in the dark near the Tannhauser Gate. All those moments would disappear like these tears in the rain. Time to die. Okay, so thinking about psychiatry. Now, the essence of the European Enlightenment was to inspire humankind to use their sense of reason in their exploration of the universe. Now, this period also saw the re-emergence of the same methods of thinking to study mental illness, whose sufferers had then spent more than 1,000 years as objects of fear and superstition. Today, the public mind is exposed to portrayals of madness in drama, literature, media, film. These are powerful influences in shaping our individual and collective perceptions of psychiatry. The Saracens say that this disease is God's vengeance against the vanity of our kingdom. Now, as wretched as I am, the Arabs believe that the chastisement that awaits me in hell is far more lasting and severe. If that is true, then I call it unfair. Now, that soliloquy was derived from Ridley Scott's epic motion picture, The Kingdom of Heaven. Has anyone seen that film? Yeah? Now, for me, it aptly illustrates the immeasurable anguish of sufferers of this incapacitating illness experience. This is Hansen's disease, leprosy. Now, they were the damage, not just in the aesthetic sense, to the extent that they were rendered so ghastly that they wore a mask to conceal their hideous appearance. It wasn't just what you could see. It's the scars that couldn't be seen that were the deepest, because they were labeled outcasts. They were ostracized. They were excluded from society. And that contributed to the torment that lepers experienced. Now this chap, the 20th century French thinker, his name is Michel Foucault, and he viewed madness as the natural inheritor of leprosy. So much in the same way that those who had leprosy, way back when, experienced social exclusion, people today who have a mental illness have become social outcasts and must now bear the brunt of stigma. A stigma was a scar on the skin of ancient Greek criminals. It was a sign to all that they were unsafe, unclean, and unwanted. Stigma still persists today in the attitude towards those who have a mental illness. We see a fundamental divide between the psychotic mind and the asthmatic lung, as if those who suffer from mental illness do so out of their own making, and as such do not deserve the same kind of empathy that we would ordinarily show to someone suffering from some other kind of long-term or chronic illness, like cancer. Anyone recognize who she is? British television personality, Trisha Goddard, diagnosed with depression, breast cancer. She said both experiences were horrible. With breast cancer, people ran towards her with open arms and hugged her. With depression, people ran away. When people found out she was diagnosed with breast cancer, she was inundated with get well soon cards. When news leaked out that she had a depression and she was admitted into a psychiatric hospital, not a peep, and certainly no cards. Stigma. Fewer than 4 in 10 employers say they would be happy recruiting someone with a mental illness. Stigma is a major issue among doctors who suffer from a psychiatric illness and can hamper disease detection and result in doctors not receiving the benefits of early intervention. I want to encourage you all, and I'm going to emphasize on encourage. I'm not here to impose my opinion on you. I'm just trying to encourage you all to deconstruct and reformulate your views on psychiatry. Not based on sensationalism, impulse, prejudice, or anecdote, but based on reason, evidence, and morality. Debunking myth number 1. Those who have bipolar disorder are not to blame for violent behavior. A study was conducted by the Department of Psychiatry in Oxford University. They examined the lives of 3,700 people from Sweden who have bipolar disorder and compared them with 37,000 people from the general public. And they concluded that people with a severe mental illness are no more likely to be violent than anyone else unless they take drugs or alcohol. This is evidence published. The research was conducted by Dr. Sina Fazel, he's a consultant forensic psychiatrist. I've met him. Published in the Archives of General Psychiatry, featured in the BBC. It's a myth. It's not true that those who suffer from bipolar disorder are more violent unless they take alcohol or drugs. The Royal College of Psychiatrists have a Maurice Murkow Award. Maurice Murkow was the registrar of the Royal College. Funds were donated in his memory for a competition. And what you're supposed to do is submit an article, 1,000 words long, and the aim is to improve the public understanding of psychiatry Winner receives £1,000. The 2010 winner, his name was Dr Ahmed, and he received the award for his article entitled Beards and Bow Ties, which was adapted. I don't know if we have any speakers. No, yeah, no speakers. Oh, well, we're going to have to improvise. My apologies, ladies and gents. So back to this. Okay, so the first thoughts. What is disease? Now, there's an individual, his name is Thomas Sydenham. He developed the medical pathological model of disease, and he argues that there has to be some kind of cause, like a bacterial infection. There has to be some kind of structural change. And this has become synonymous in many people's minds as the definition of disease. You know, you have to do you do an X-ray, if you've got pneumonia, you will see the changes on the X-ray. That's how we define disease. Now, Thomas Sass is an anti-psychiatrist, and he criticized psychiatry in general by suggesting that its diseases fail when this model is applied. Now, there was an article published in the British Medical Journal in 2002 by Smith and colleagues, and it's entitled In Search of Non-Disease. And basically, I'll try to go through this with you. So these are the respondents. You see the percentage of respondents. So when they were asked if do they think, for example, schizophrenia is a disease, many respondents, they agreed. You see, it's quite high up there. They did perceive schizophrenia to be a disease. But depression didn't do so well. Alcoholism didn't do so bad. Respondents perceived this to be a disease. Now, a lot of respondents perceive epilepsy to be a disease, but the pathology is not well described. You do a scan of their brain, you'll see no structural changes. Likewise, head injury. And also, the respondents didn't perceive that to be a disease, but their pathology is well described. But what disease? Somebody's arguing that a disease is when there's some kind of anatomical or structural change, but we have varying responses here. Great wits are sure to madness near allied, and thin partitions of their bounds divide. In other words, there's a very fine line between what is sane and what is insane. That was the 17th century English poet laureate, John Dryden. There was bipolar disorder. It's commonly known as manic depression, and it's one of the most common, severe, and persistent psychiatric illnesses. It's a mood disorder, and classically periods of prolonged and profound depression, so low mood, alternate with periods of excessively elevated and or irritable mood, known as mania. Between highs and lows, sufferers usually experience full remission. And in the public mind, it's associated with creativity or creative madness. And indeed, it has affected many creative people. Anyone recognize who this chap is? 18th century English poet, English romantic poet, Lord Byron, notorious in life and in death. Very prolific. He had bipolar disorder. Okay, so what's creativity? So most definitions of creativity emphasize novelty and originality balanced against utility. Is it useful or not, what you're producing? Is it novel? Is it original? And is it new? And does it have any use? That's how people define creativity. Now, the notion of creativity and craziness, that there's an association between the two, is an ancient one. We all know Aristotle. Aristotle said that if a man comes to the door of poetry untouched by madness, then he and his same compositions never reach perfection, but are utterly eclipsed by the performances of the inspired madman. Most famous philosopher in history. Now, there was a recent study spearheaded by the American professor Kay Ritfield Jamison, published in her book called Touch with Fire. And the results of the study revealed that there's many overlapping mood, cognitive, and behavioral changes between hypomania, which is not quite manic, and creativity. She's saying there's overlap between the two, the cognitive changes, the behavioral changes, and the mood changes. So a psychologist, the American psychologist J.P. Guilford, identified factors that were involved in creative thinking. And many of these relate to the cognitive changes that take place in hypomania as well, or myomania, which is hypomania. So you have something called word fluency, the ability to produce words that have a specific letter or combination of letters. Then you have something called associational fluency. So that's the production and rapid juxtaposition of phrases or sentences. And then you have expressional fluency. And then you have ideational fluency as well, when you are asked to express an idea that should fulfill a requirement in a specific time period, in a limited time period. And all of these features that you would get in creativity, you would get that in hypomania as well, according to the results of recent research. These are the cognitive changes. Cognition is how you think. Famous people who suffer from bipolar disorder, statesmen. Anyone recognize these pictures? Abraham Lincoln, US statesman. Apparently one of the greatest, I think we have an American in the audience, don't we? Yeah. But is his legacy one of the greatest presidents in the history of America? We have, who was that, sir?
Napoleon.
Napoleon, yeah. Again, French leader. And you recognize the individual in the bottom left-hand corner? The greatest Briton ever? Churchill, yeah. All of these leaders had bipolar disorder. Poets. I was reciting some of the, does anyone know that poem I was reciting? You have the American in the audience, you should know it. The Raven. Yeah, Edgar Allan Poe. This guy here, Rude Boy Kipling, or rather Rudyard Kipling. That Dylan Thomas, Death Shall Have No Dominion. Writers, Leo Tolstoy. Any fans of Russian literature? Yeah, what's the title of his masterpiece? War and Peace. Probably the greatest novel ever, right? Conceived. You have here Charles Dickens. Anyone watched that film recently, The Great Gatsby, with Leonardo DiCaprio? Yeah, he's the creator there. F. Scott Fitzgerald. They all have bipolar disorder. Actors. I know the ladies like the guy in the Robert Downey Jr. And you have here, does anyone recognize him? Yeah, not to say that the ladies don't like Stephen Fry. I mean, you know. He is a national treasure after all. And he created the documentary, The Secret Life of the Manic Depressive. So, which I would recommend you watch, by the way. And he's also the author of this book, The Fry Chronicles. Anyone read the book? No? No? One could argue, where would humankind be without bipolar disorder? Some of the greatest leaders, actors, poets, artists that have graced history. Yeah? Anyone seen the film? Yeah, Silver Linings Playbook, the protagonist had bipolar disorder. So what is mania? Mania is a period of abnormally and persistently elevated and expansive and irritable mood with 3 or more characteristic symptoms. The episode should last for 1 week, so the duration has to be 1 week, unless it's severe enough to warrant hospitalization. And so by definition, it has to impair social and occupational functioning. And sometimes they can become psychotic as well. They develop these kind of hallucinations or delusions. Am I right, Elsa? They can get a psychosis sometimes, which tends to what we call mood congruence. So someone who's manic might have these delusions of grandeur. They were here to rescue some damsel in, that's not a delusion, is it? No, to save the world from Armageddon or something. You can rescue a damsel in distress. Why not? You can be a knight in shining armor. Let's be romantic. Okay, so the features of mania: increased energy. And you've got increased self-esteem. Like I said, the grandiosity. You can be quite over-familiar as well. Invading somebody's kind of personal space, they can be like that sometimes. They can be over-familiar. They have reduced attention. They can become really kind of increased distractibility as well. And they tend to engage in behavior that has serious consequences. Like spending sprees. And does anyone know what I mean by amorous activity? It's a euphemism. Okay, so you know what I mean by amorous activity. Okay, so according to Professor Brian Hurwitz, who is an eminent scholar in the health humanities, there's a growing perception that science alone provides overall insufficient foundation for the holistic understanding of the interaction between health, illness, and disease. Now, echoing this message, in an article that was published in the Royal Society of Medicine, the Prince of Wales beckoned for wider perspectives on healthcare, and he asked doctors to develop a healing empathy. I'll give you an example of the limitations of modern healthcare. 5 to 15% of patients who have schizophrenia who take medication still experience psychotic symptoms. Medication is not the magic bullet. And I'm attempting to convey the limitations of modern medicine. Now, over recent years, the health humanities has emerged as a distinct entity in attempts to ameliorate the limitations of the provision of healthcare services. And autobiographical narrative, including autobiographical narrative from Carl Jung's Wounded Healer, and I'll describe what that is. It falls under the remit of the health humanities. This is MedFest. Has anyone heard of MedFest before? The Medical Film Festival. They tour universities throughout the country. And the founder was the winner of the article of Beards and Bow Ties, Dr Ahmed. And it's actually this month and next month, February and March. I think they're coming to Manchester. They'll be all over the country. And the admission is free. Free admission. Free refreshments as well. Although here we give you free Domino's pizza. Okay, anyone know the author? Anyone heard of this book before? The Man Who Mistook His Wife for a Hat? Yeah? Oliver Sacks. Best-selling book. And he said that in the preface, he said that in order to restore the human subject at the center, the suffering, afflicted, fighting human subject, we have to deepen a case history into a narrative or tale. Does anyone know the title of his other famous book that was made into a movie? Awakenings, yes, absolutely. The Awakenings. Starring Robert De Niro, Robin Williams. And in the preface of that book, he said that a special place must be reserved for those colleagues who know and can describe the world of the Parkinsonian with an incomparable authority from the inside. So those who suffer from that particular illness have the incomparable authority. They are the experts. You can argue, you can dispute that, but something to mull over. Okay, now this is Cutting Edge Psychiatry in Practice. It's a peer-reviewed psychiatry journal, and it was recently launched. And in each issue of that journal, they have a particular theme. So this is issue 3, this is on bipolar disorder. They asked me to write an article. I have 3 articles in this. I was really fortunate to publish 3 articles in this. In issue 1, it was schizophrenia. So each issue has a theme, and they include in that theme an autobiographical narrative from the sufferer of that theme. Does that make sense? Okay, so issue 1, schizophrenia. Author of the article, My Colourful Life of Schizophrenia. That was David Horwick. So what I did was, I met David in Cambridge. I said, yo David, let's join forces. I mean, we could rule the world. Well, didn't quite rule the world, but we did publish an article that was we did co-author an article rather that was published in the British Medical Journal, and it's entitled The Verses of Madness. So not just bipolar disorder, but schizophrenia has an association with creativity. And we did a review of the literature, and we found some evidence to support that there is an association between schizophrenia and creativity. And then David, he wrote his own autobiographical narrative. And he made reference to a poet called Charles Bukowski. Are you the only American in the audience? Is there any other Americans in the audience? No? Charles Bukowski, I don't know if you've heard of him, American poet. Was that, sir? He sounds familiar, yeah. And he said that poetry is the ultimate psychiatrist. And David, he said that, it resonates. He's a firm believer of that. Now, David is romantic, very romantic, but he's a realist as well. He said that his recovery, his convalescence, heavily depended on medication, diet, and lifestyle changes. But his true inspiration was the power of poetry. And he's actually published a book of his own poems. Me and David, there's a conference in London, the International Symposium of Poetry and Medicine. Do we have any medical students in the audience, or medics, or yeah? Anyone heard of that conference before? Or, no? It's So that's in the Wellcome Trust every year. So we presented the poster in London. Okay, so Carl Jung, he was a very famous kind of psychoanalyst, and he described this kind of archetypal dynamic that exists between the service user and the service provider, the analyst and the analysand. And Jung discovered the wounded healer in relation to himself. For Jung, it is his own hurt that gives a measure of his power to heal. And the ancient shamans, and heard of shamanism before, you can't be a shaman unless you've experienced an illness, unless you've experienced that particular illness. So it's actually an ancient concept as well. So he's arguing, I think, in a way, that to be empathetic, to understand the service user's perspective, you need to go through that experience yourself. We don't need to, but I think it would make you more empathetic. Another American psychiatrist, Kay Rickle Jamison. She is the world authority on bipolar disorder. She's professor of psychiatry in Johns Hopkins in the States, one of the best medical schools in the world. She's a professor of English literature in St. Andrews. She has a mastery of the English language, which serves her well because she has bipolar disorder. And she composed her own autobiography. So she's the wounded healer. She composed her own autobiographical narrative, An Unquiet Mind. According to critics, one of the best books in 1995. It'll take you 2 hours to read it. Gives you that precious, and she's so eloquent. It's extraordinary. Gives you that precious insight into what bipolar disorder is. Who's he? Anyone recognize who he is? The greatest hero in cinematic history. Anyone heard that book before? To Kill a Mockingbird? So who's Atticus Finch? You want to understand someone, you have to slip into their shoes and walk around in them. Okay? Winner of the 2012 Maurice Markow Award, Claire Polkinghorne. The title of her article was Doctors Go Mad Too, and I'm going to read it out to you. As a psychiatrist, I had hoped that I was pretty good at empathizing with my patients. However, the last 9 months of my life have taught me more about mental illness than years of clinics, ward rounds, home visits, or reading psychiatric literature. She was diagnosed with a depressive illness. She was detained under the Mental Health Act, and she remained an inpatient in an NHS hospital for 6 weeks. Doctors go mad too. Alright, okay. This is my story. So I was born in Belfast, so there's a leprechaun lurking in me, but you will notice that already. Raised in Dublin, and I moved to the war-torn land of Lebanon at the time. It was just the aftermath of the war. And then I left my family when I was 17, and I did well in school. So I graduated top of the class I attended. I came to England, I was like, right, okay, money grows on trees. It's going to be great. I'm going to get into Oxford or Cambridge, I'm going to be a doctor, I'm going to heal the world. And then, the people are thinking like, oh no, wait a second, so we have other plans for you. So here's a mop, and here's a bucket, and you want to clean some floors for us. So there was expectation, and there was achievement. And I was like, wait a second, I graduated top of my school. We don't recognize your qualification. You got to do the A-levels. Right. Okay? And then they didn't consider me a home student, even though I have a British passport. You have to be here, you have to be resident here for 3 years or something, and so there, I felt low. I left everything I knew behind me. My family was still in Lebanon. I didn't know anyone. I was in Leeds. But, however, I knew that I was, in a way, very fortunate because I was given this kind of golden opportunity, a decent shot at life that had been granted to me because of the sacrifice that Britons of previous generations had made. I just had to do those 3 years, get the residency, get my A-levels, and that would be my ticket into medical school. And if I squandered that opportunity, that decent shot at life, I would be damned. I knew that I had plenty to be grateful and sanguine about. Just be patient, put things into perspective. Okay? So I was trying to, I guess, in a way, provide myself with therapy. Then afterwards, I got straight A's, very pleased to say. And this guy is an English, he was a serviceman. This is the Lawrence of Arabia. I don't know if anyone's seen the film. Lawrence said, all men dream. This is one of my favorite quotes. He said, all men dream, but not equally. Those who dream by night in the dusty recesses of their minds, they wake in the day to find that it was vanity. But the dreamers of the day are dangerous men, and they may act like dreams with open eyes to make them possible. That really resonated with me. And it inspired me. I got into medical school. It was my dream. Cleaning floors. Now I'm in medical school. Fantastic. Great. 2006, war in Lebanon. Woke up one morning, hometown was bombed. Tried to call my parents, couldn't get through to them. Are they still alive? Happened overnight. How does that make you feel? Do you know if they're alive or not? You think you know yourself. You think that you could never, lose your mind. You think you know yourself. But unless you've been through these kinds of experiences, you still have a lot to discover. And I hope it doesn't happen to anybody. I really hope it doesn't happen to anyone. Because I started to develop these thoughts. I was dreaming dreams that no mortal ever dared to dream before. These grandiloquent ideas. I had reduced need for sleep. I had increased energy. I had pressured speech. You name it. I was also quite disinhibited as well. I have friends here actually. I'm not going to point them out. They've seen me actually. They're right here. They're very good friends of mine. I wasn't doing so well. And I was actually elated. There's something called effective incongruity. So my world just turned upside down. And I was actually very, very, very happy. But this would soon change. Now, C.S. Myers in The Lancet, he published an article. And he said that everyone had a breaking point. Weak or strong, cowardly or courageous. War frightened everyone witless. Sometimes an appropriate response to reality is to go insane. You wake up one morning, your hometown's gone. If I was to ask anyone in this audience, how would you react? How would you react? You see these images coming from Syria right now. They're far removed. These people are far removed, but for them it's the reality. Of course there's going to be high rates of mental health challenges. Sometimes an appropriate response. So no, that was the previous quote. This quote is, anyone recognize this film? Insanity is like gravity. All it takes is a little push. Wow. Again, I could identify, right? That resonated with me. I don't know if you have any history of medicine after you see notice here. This guy, we have some medical students. So there's a structure in the brain, vascular structure, that's named after him. Circle Willis. This guy is Thomas Willis. And he was very erudite. He really was ahead of his time, trailblazer. Discovered the path of the spinal accessory nerve, all kinds of jazz. What really inspired me was that during his lunch break, you know what he used to do? He would give his lunch away to the poor. When you're hungry, you haven't eaten all day. And he was so selfless. He wouldn't think about himself, he put others in front of him. There were homeless people, he would give his lunch away to the poor. That had a profound effect on me. It's like, wow. Wow. I'll never forget reading that. I mean, who am I to complain? I have been bestowed with so much good fortune in my life. Am I grateful for this, or do I take it for granted? What is life like for those who are less fortunate? What about the homeless? Just homelessness. Shelter. Shelter is, we need shelter. It's a requirement for human existence. It's not a given for everyone. Was I grateful for that, or was I taking it for granted? If I want to understand what life is like for those who are less fortunate, I have to slip into their shoes and walk around in them. So, I crossed the Atlantic. I went to Boston. Have you heard of Spare Change newspaper before? Have you heard of Spare Change newspaper? No. So, anyone heard of The Big Issue? Yeah, it's the same, the counterpart. So I was like, what's life like with that vendor over there? So I was a vendor. And that's my first article. Crisis in the Middle East. I couldn't believe I found this on Google. I was like, oh wow, brings back some memories, isn't it? And I sat in the street for two nights. And I said to myself, if I want to understand how hard it must be for the homeless, I have to slip into their shoes and walk around in them. Am I truly grateful for the blessings that have been given to me? Right. I was in Boston Government Center, and I was manic out of my mind. And when you're manic out of your mind, imagine me now, I'm exuberant now. My friends will testify. Mania is a different thing altogether. You are beholden to the spur. And when you are beholden to the spur, flights of fancy and notions of romanticism compel you. There was this demonstration in Boston Government Centre. 500 people were there. And the speakers, this guy's from MIT, that guy's from Harvard, and that. I strode resolutely to the centre of a spacious stage. I swept the event organisers aside with brusque disdain, and with the searing eloquence of a seasoned preacher, declaiming from his pulpit, I proceeded to bellow this nation's favourite poem. If you can keep your head in all about you, or losing theirs and blaming it on you, if you can trust yourself and all men doubt you, but make allowance for the doubting too, if you can wait and not be tired by waiting or being lied about, don't deal in lies. Or being hated, don't give way to hating, but don't look too good or talk too wise. Now if you can dream and not make dreams your master, if you can think and not make thoughts your aim, if you can meet with triumph and disaster and treat those two impulses just the same, if you can make one heap of all your winnings and risk it all on one turn of pitch and toss and lose and start again at your beginnings and never be the word of your loss. If you can force your heart and your nerve and your sinew to serve your turn long after they are gone, and so hold on when there's nothing left within you except the will which says to them, hold on. If you can talk to crowds and keep your virtue, or walk with kings and not lose that common touch, if neither loving friends or foes could hurt you, if you could count, if you could fill rather to unforgiving minutes with 60 seconds worth of distance around, yours is the world and everything that is in it, and which is more, you will be a man, my son. When I was in Boston, I was like an Arab in America, and I was very kind of, like I said, manic, and I said it with a lot more emotion. It's kind of similar response from the audience. They were, I think, they were taken aback. It was a spectacle to behold. The aftermath of mania is invariably melancholia. I started to sink into the murky depths of a depressive illness, a depression too dreadful to describe. I was ostracized by my so-called friends. This social exclusion had a deleterious effect on me. I was sinking deeper and deeper into the darkness. What is depression? Depression is, well, anyone seen this film? 25th Hour? Champagne to my real friends and real pain to my sham friends. I'm telling you, you can make it, you know who your sham friends are when you're manic, you know who your real friends are, because my real friends are here today. And they're still by my side. Okay, so when you're depressed, the symptoms, low mood, feelings and thoughts of hopelessness, worthlessness, guilt. You either sleep too much, insomnia, or you sleep, you either don't get any sleep at all, insomnia, or you sleep too much, hypersomnia, reduced energy, feelings of, you get these thoughts of wanting to kill yourself. It's horrible. It's absolutely horrible. But the social exclusion, I can assure you, was the worst of it. And what happened when I was manic, very generous, and then the medical school, I was a medical student, interrupted my studies, severed my student loan, can't find a job, my parents are not here. How do I survive? Where do I live? I don't have anything to provide for myself. I slept on the streets again. In 2010, I convalesced. Since then, I've been in full remission without having to take any medication. Now, I'm not trying to advocate that. You need to consult an expert. And I am, they know that I'm not taking any medication, so I'm okay. Now, I qualified for medicine in 2011. I got what we call the Foundation Achievement of Competence document. And then I commenced my appointment as a National Institute of Health Research Academic Clinical Fellow in Psychiatry with Magic University. And they're difficult posts to get. It's an academic post at the university. So, I was really pleased. How did these life experiences make me feel? The outcome for people who have bipolar disorder? Suicide. They kill themselves. Highest rates of suicide are in bipolar disorder. I am so fortunate to still be alive. Let's put things into perspective. What's life like for the people in Syria right now? I have so much to be thankful for. And these life experiences have made me realize just how fortunate I really am. You know? And I feel now it's my duty, firstly, to speak out against the stigma. I'm taking a firm stand against the stigma associated with mental illness, and in the medical profession in particular. But I feel it's my duty to help those who are less fortunate. Like for example, I'm working on a project now, I'm trying to help the orphans in Syria. Let's put things into perspective. The 2013 Maurice Markow Award winner, Clementine Maddock, she's a psychiatrist, and she said that she's unused to seeing patients injecting heroin at the age of 11. Victims of physical sexual abuse. I do not know what that must be like for them, to be deprived of the innocence and happiness that we all should experience as children. Let's put things into perspective. Let's help these people. Let's give something back. Let's not take for granted the many blessings that have been given to us. What's these life experiences done to me? I have a fire burning in my belly, a determination to realize the potential that is inside of me. It's surging within me now, this determination. And I want to make the most of these opportunities that I have. You don't appreciate health unless you've experienced illness. Okay, right, so 2012, the World Psychiatry Association, the highest authority in psychiatry, they announced this cultural psychiatry conference in Tel Aviv. So this is when I recovered. And I was trying to be active, proactive, you know. And for me, film wields a colossal power. Through the journey of a single film, we can take a roller coaster ride across the spectrum of human emotion. Film can enthrall an auditorium heaving with people. It can silence and even reduce them to tears. Film doesn't just move us, it can inspire us to change. I wanted to use the power and synergy of film and psychiatry. I used this as my platform, MedFest. In 2012, they wanted to explore the portrayals of mental illness, the ethical and the political implications. And the movie and the film that I wanted to focus on was Waltz with Bashir. Anyone heard of Waltz with Bashir before? The Israeli animated documentary film that was nominated for an Oscar for Best Foreign Language film. Banned in Lebanon. It's about this Israeli veteran, inspired by true events. He was a serviceman, and his tour of duty was in Beirut in 1982. And that's when the massacres of the Palestinians took place in Lebanon. Those dark memories haven't faded. The massacres in Lebanon of the Palestinians, I don't know if anyone's heard about the Sabra and Shatila massacres. So this is what the film's about. 2006, war in Lebanon, what precipitated my episode. Former Prime Minister, I've met him before, it's in Europe. Former Prime Minister of Lebanon said, Lebanon will be the last Arab state to have peace with Israel. No peace. Anyone heard of the documentary, The Manhattan Project? Yeah? There's a 20th century Polish scientist, Professor Joseph Rotblat. So a bunch of people got together. Einstein harnessed the power of nuclear energy. And a bunch of people got together. And they were all invited, they were all signatories. And they went to New York. And I think they all came together because they wanted to talk about what could be done with this power. He withdrew on moral grounds. He didn't want to develop this project any further because he could foresee that this kind of energy could be used for nefarious reasons. And he was right. Look what happened. Hiroshima. They used nuclear energy, and he could tell in advance. He had that foresight. And such a good man, such a good heart. And in the documentary he said, so long as you view the situation in terms of them and us, there will never be peace. If you look at it in terms of them and us, you can't reconcile. There's no reconciliation. I wanted to deliver the peaceful message of coexistence between the Arabs and the Israelis. I submitted the abstract on World Psychiatry and MedFest. The scientific committee must have been impressed. They invited me to give a keynote lecture in Israel. A Lebanese man in Israel. The two countries are still at war with each other. I landed in Ben Gurion International Airport. I was anxious. I thought the passport control were going to detain me, interrogate me, do God knows what to me. There was one portly chap holding a placard with my name on it. Extended my hand. He extended his hand rather. Smile on his face. Silenced everyone on passport control. Opened the gates of Tel Aviv. Ushered me, gently ushered me. Didn't ask me a question, didn't lay a finger on me. I was astonished. And I was received very warmly by the organizing committee. Herschel, Babbage. Babbage was Herschel's protege. And he was looking through this telescope and he said, I cannot see these lines you speak of. So these are the stars. These faint lines are the forerunners of these stars. And his mentor said to him, an object is frequently not seen from not knowing how to see it, other than any deficit in the field of vision. And then Babbage was able to see these forerunners because he was taught how to see them. And he later discovered in 1861 that every known star was made up of the elements on Earth. His mentor's great insight, Herschel's great insight was the human mind must be prepared for what we will see, otherwise it will remain obscure. If we don't prepare our minds to see peace, it will forever elude us. This is the abstract I was talking about. Tel Aviv, Israeli, Arab, embracing each other. I don't have any misgivings. It's going to take more than a lecture to resolve the ongoing Arab-Israeli conflict, but it did give me that glimmer of hope. Maybe one day we can live in peaceful coexistence. Every avalanche starts with a snowflake. Okay, mental illness in doctors, overrepresented. Who will watch The Watchmen? 25% of doctors experience depressive symptoms. Suicide is also overrepresented in this population. Contributory factors: alcohol, depression. Being a doctor is stressful. Breaking bad news. You've got to work nights. You're bound to experience some kind of mental distress. The founder of modern medicine, Sir William Osler, the physician who doctors himself, has a fool for a patient. You are not the best person to assess yourself, or plan your treatment or referral. The best recourse: register with a GP. Up to how many? 2/3 of junior doctors haven't registered with a GP. Show of hands if you've registered with a GP. Yeah, good. Those of you who haven't raised their hands, please register with a GP, please. Those of you experiencing mental distress in any of its many forms, I know the world can be a dark and lonely place, but you're not alone, because there are people who understand and who care. And we'll do our best to find you. And we will find you. Gabriel Jamison. Remember her? World Authority on Bipolar Disorder? They learn and suffer what they teach in song. An artist survives, describes, and then transforms psychological pain into an experience with more universal meaning. So his or her own journey becomes one that others can thus better protect and take. Doctor Support Network. It's a British charity, and they provide support to doctors and medical students who are under mental distress. And it's a confidential service. They have an anonymous email forum, they have a helpline, and if ever you have to go to a GMC procedure, General Medical Council procedure, they can give you advice if you have to go to them on health grounds. Anyone know who he is? Medical students probably know him. Trust Me, I'm a Junior Doctor. Max Pemberton. I'd recommend you read his book, Trust Me, I'm a Junior Doctor. Reasons why I recommend is because it helps you develop that healing empathy that I was referring to earlier on. And it's amazing because he looks at life from the perspective of service users. It's extraordinary how humble he is, and it really is inspirational. He puts himself in his shoes or her shoes, and that was really, really, really kind of touched me. Take our messages. We're done now. We've done so well. Come a long way. It's been almost an entire hour. Can you believe it? So bipolar disorder is a common, persistent, and severe mood disorder, characterized by periods of profound prolonged and persistent depression, which alternates with mania. And there are periods of full remission between episodes. 1 in 4 of us suffers from mental illness at some point in our lives. 1 in 4 of us in this room will suffer or has suffered from a mental illness. It's common. It's overrepresented in the medical profession. Reading and writing autobiographical narratives of those who have had these experiences, it can embellish our humanity. It gives us that precious qualitative insight. And stigma is a real major issue with psychiatric illness. Countering stigma and negative views starts off with the individual by challenging our own prejudices and preconceptions, and being more accepting of doctors who experience mental health challenges will help to reduce the stigma and result in better outcomes. After all, it could be you or someone you know. The strengths, the merits of the autobiographical narrative. I'll finish off with my poem, which got published. It's entitled "The Conflagration in My Wake." I'll take my jacket off. Regards the conflagration in my wake, an inexorable inferno, burning bridge after bridge. Emancipate me from the shackles of bipolar. Release me, I beseech thee, from the indignations of my past. Take up the quill, I will, and relate my tale of woe I shall. But wait, an incandescent silver lining. Was it not the mystic Khalil Gibran who proclaimed that the more melancholy carves into your being, the more jubilation it can contain? So adorn my face then, not with a masquerade, but with a smile that never fades. I'm patient no more, but healer now I am, and off into the kingdom of the sick I shall foray, with lineament and manner, born out of experience as my instruments of healing. And when I behold my neighbour's gaze, she whispers, "You are a good doctor, Dr Hanker." And unbridled joy gushes forth from my heart. It's not me who heals you, my dear. It's you who heals me. One question. Does having mental health challenges mean that you cannot realize your dreams? What do you think? Never! And I'm very pleased to inform you that I received the World Psychiatry Foundation Doctor of the Year Award. Any questions? You're a wonderful audience. Is that okay? Can you put that in writing? You got some feedback forms? Do we have any more pizza left? Have you devoured the pizza? That's a good job.
There's still some
we got
left
7 large pizzas. Okay, I hope that's okay. Do you think if I did an event like this in the future, other people might be interested in attending maybe, or?
Yeah, sure.
Yeah? Yeah? Okay, so because we're planning on, doing something like this again. So please, I hope you liked it. Do fill back the feedback forms. And we'll send announcements out in the International Society and let all your friends know. Spread the word. Spread the word. Thank you. What do you